Welcome to NHS Lanarkshire post-surgery aftercare and advice video. This will take approximately 10 minutes and we would appreciate you taking the time to watch this video. At day 3, we will ask you to remove your initial dressing. To remove initial dressing, you can either soak dressing while in shower or bath, or alternatively prepare a basin of water as instructed in this video. In order to soak dressing adequately, place feet in basin of water for approximately 5 minutes so that dressing can be easily removed. Do not pull off dressing as this can cause bleeding and discomfort. Start by removing the adhesive tape. This should come off easily. If it is still sticking, keep soaking until it is easily removed. Next, gently remove the outer gauze. Do not be alarmed if the dressing looks stained, as this is normal. If the outer gauze is still sticking, keep soaking until it is easily removed. Once outer dressing is removed, then resubmerge foot and gently remove the inner dressing. This again should come off easily. If not, continue to soak. As you can see, the skin will appear macerated and the wound will appear raw. At this point, add 1 tablespoon of salt to the water and bathe further for no more than 5 minutes. After all the dressings are removed, you can then remove your feet from the basin and allow them to air dry. When foot has fully dried, we would ask you to dress the toe. Start by snipping the corner of the dressing as shown. Then gently place the centre part of the dressing over the wound and secure the dressing as demonstrated in this video. Remember and do not touch or clean your wound, as this may contaminate the wound and delay healing. We ask that you repeat this process every 2 days. After the first week of dressing your toe, the dressing will still be sticking to the wound as discharge increases. Make sure that you soak dressing to ensure easy removal. This can either be in a bath or shower or a foot bath as shown. Once dressing is easily removed, place your feet once again in a salt foot bath as directed. Please ensure that this is no longer than 5 minutes. And again, do not wipe or clean the wound. After the 5 minutes, remove feet and allow to air dry. At this stage, the wound will still appear raw with the beginnings of a slight yellow discharge visible. This is perfectly normal. Now redress as previously shown. After the second week, the discharge will increase dramatically and will be visible through the dressing. Once again, ensure that dressing is soaked adequately to allow easy removal. The wound will have more of the yellow discharge visible at this stage, and again, this is perfectly normal and must not be removed or cleaned. After approximately week 3, the yellow discharge will yet again have increased and thickened, and the surrounding skin may be inflamed and macerated. This is to be expected and should not cause concern. Continue with the dressing regime every second day using your salt foot bath and allow the wound to air dry before redressing. After approximately week 4, the wound, even though it still has a yellow appearance, will now have a slight shine to it, and the discharge will be slightly decreased, and the wound will not appear as wet or runny. At this stage, we would ask you to stop using the salt foot bath, but please ensure dressing is soaked for easy removal. After approximately week 5, you should start to see signs of drying at the top end of the toe, with the area at the cuticle still having a yellow appearance and discharging. If the wound has been disturbed, you may see a red raised tissue appear within the wound. This is due to trauma and may cause slight delay in healing. After approximately weeks 6 to 8, you will see the wound drying towards the cuticle area, and the discharge will at this stage be decreasing. Continue to dress the toe as previously shown and to keep the wound as dry as possible. No foot baths should be used at this point, as we are looking for the wound to dry and form into a scab. At approximately week 9 onwards, a scab will form over the wound, which will dry as it progresses. If there is no discharge on your dressing, you can now stop dressing the toe. The scab will be there, but this will fall off naturally and expose the skin underneath, which for a period of time will have a slight red appearance and will disappear in time. Congratulations, your toe is fully healed. If you have any further questions, please do not hesitate to contact our Podiatry Hub. Thank you.